Gynecological scanning tips. Legal disclaimer. Information is for general and educational purposes only. Content is not nor intended to be a substitute for professional, legal, or clinical advice. While we strive to make the information as timely and accurate as possible, we make no claims, promises, or guarantees about the accuracy, completeness, or adequacy of the information obtained, and expressly disclaim liability for errors and omissions. Course objectives. At the conclusion of this session, participants will be able to verbalize the importance of gynecological scans to women. You'll be able to verbalize what is gynecological ultrasound scan. You'll be able to verbalize how it differs from other types of ultrasound. You'll become familiar with the common challenges in performing gynecological scans and different scanning tips. Why is this topic important? Gynecological scanning tips are important because they provide valuable information and early detection of various medical conditions related to women's reproductive health. These scans can help diagnose and manage conditions such as endometriosis, polycystic ovary syndrome, fibroids, and other abnormalities in the uterus, ovaries, and cervix. They can also monitor the progression of these conditions and evaluate the effectiveness of treatment. Gynecological scans are typically non-invasive and painless, making them a convenient and safe option for monitoring reproductive health. Regular scans can provide peace of mind knowing that any potential problems can be identified and addressed promptly. Gynecological scans can also help determine the severity of the condition and guide treatment plans. For instance, transvaginal scans are recommended for a more detailed evaluation of the pelvic organs, especially when diagnosing endometriosis. These scans involve the insertion of a probe into the vagina to capture images of the pelvic organs, which can help identify the presence of endometriosis, locate its exact location, and assess the extent of the disease. What is a gynecological ultrasound scan? Also known as gynecologic sonography. It's a medical procedure that uses high-frequency sound waves to create images of the female pelvic organs, including the uterus, ovaries, fallopian tubes, bladder, adnexa, and rectouterine pouch. The purpose of this scan is to detect myomas, Müllerian malformations, and other conditions affecting the female reproductive system. Gynecological ultrasound scans are used extensively for various purposes, such as assessing pelvic organs, diagnosing acute appendicitis, managing gynecologic problems, identifying adnexal masses, diagnosing gynecologic cancer, tracking the response of ovarian follicles to fertility medication, and performing transvaginal oocyte retrieval in IVF. A transvaginal ultrasound scan can show up changes in the womb, ovaries, and surrounding structures, such as thickening of the womb lining. It is a safe test, but it may cause some slight discomfort during the procedure. Gynecologic scans differ from other types of ultrasound because they focus on the female reproductive system, including the uterus, ovaries, cervix, and fallopian tubes. It can be performed both externally or transabdominally using a transducer on the abdomen, or internally using a transducer inserted into the vagina, known as a transvaginal ultrasound. The internal approach provides higher resolution, making it the gold standard for gynecologic ultrasound. Gynecologic scans differ from other types of ultrasound. Gynecological ultrasound scans are used to diagnose and monitor various conditions such as heavy or painful periods, pelvic pain, assessing the position and location of an IUD, bloating, infertility, irregular or infrequent periods, postmenopausal bleeding, and incidental findings on other imaging modalities. The internal ultrasound can provide valuable information when considering IVF treatment, follicular tracking, or investigating subfertility. It can also provide better visualization of smaller intrauterine fibroids, small ovarian lesions, and intracavity lesions, especially when determining the fibroid's relationship to the endometrial cavity. Gynecological scanning tips. Some ultrasound gynecological scanning tips. Establish a rapport with your patients, make them comfortable, explain everything you're doing throughout the process, and address any concerns that they may have. Maintain privacy, ensure the patient feels secure and respected. Use draping appropriately to maintain privacy. Warm the ultrasound gel. Sometimes it adds a nice touch and helps the patient be more comfortable. Position the patient comfortably on the examination table with adequate support, and just play it, just make sure that your patient is comfortable. Explain things, answer questions, make your patient as comfortable as possible is the most important part. Also, use gentle pressure with the transducer to obtain optimal images. Communicate with the patient to ensure they are comfortable throughout the procedure. Be sensitive to any discomfort the patient may experience during the examination and adjust accordingly. Explain each step, communicate each step of the examination process. Educate the patient what you'll be looking for, what the images are going to find, any findings that may be relevant to their health, the comfort level of the patient, and make adjustments if necessary. Approach the examination with empathy and understanding, recognizing that it may be a vulnerable experience for the patient. Be patient, take your time during the examination to ensure thoroughness and accuracy. Rushing can lead to discomfort and potentially missed findings. Follow safety guidelines. Adhere to safety guidelines for ultrasound equipment and procedures to ensure the well-being of both the patient and yourself. And stay up to date with your continuing education and training. So in conclusion, a gynecological ultrasound scan is a medical procedure that uses high-frequency sound waves to create images of the female pelvic organs, including the uterus, ovaries, fallopian tubes, bladder, adnexa, and rectouterine pouch. It can be performed using transabdominal ultrasonography or transvaginal ultrasonography and is used for various purposes, such as assessing pelvic organs, diagnosing acute appendicitis, managing gynecologic problems, identifying adnexal masses, diagnosing gynecologic cancer, tracking the response of ovarian follicles to fertility medication, and performing transvaginal oocyte retrieval in IVF. Gynecological scanning tips are crucial for women's health as they can provide detailed information about reproductive organs, detect abnormalities or potential health issues, and significantly improve the chances of successful treatment and recovery. They are non-invasive and typically painless, making them a convenient and safe option for monitoring reproductive health.